Welcome to Nursing School Explained and this second video about how to prioritize NCLEX as well as exam questions appropriately going into the ABC, airway, breathing, circulation approach. Now, if the question gives you the information and you determine that there is no problem with the airway, so A, check mark. And then for number 2, you see any of these terms for breathing. So any of these terms will let you know that there's something going on with the patient's breathing status. That means that this should be your prioritization. So terms that you might see: asymmetrical or absent lung sounds, asymmetrical chest wall movement, or a flail chest. And all three of these really pertain to trauma to the chest, where we either are dealing with a pneumothorax, a hemothorax, a tension pneumothorax, multiple broken ribs, any of that can impair the patient's breathing. And then moving on here, any abnormal lung sounds should always hint that there's a breathing problem that requires an intervention. Any abnormal respiratory rate, and that might be low as well as high, elevated. Any abnormal O2 sat, so anything that's considered normal, less than 95%, or if the patient has a chronic lung condition, may be a little bit adjusted, but the question would have to actually go over that. And then tracheal deviation, such as we would see in a tension pneumothorax. And as I explained in the other video, some might think that this is an airway problem, but it fits in kind of both categories. And then also think about sputum production, not necessarily only like greenish yellow sputum that makes us think about infection, but think about pink frothy sputum where the patient would go into pulmonary edema from congestive heart failure, where we really worry about the lungs kind of flooding with the secretions and then the patient not being able to breathe right. But of course, that would also be manifested in abnormal respiratory rate and O2 sat. So please also check out the other videos where I go about terms that tell you about airway and circulation problems. And then of course, if you want more information on any of these conditions I just discussed, check out my channel. Most of those will be in the critical care playlist so that you know how to tackle those and learn more about them. Thanks for watching. See you soon.